The deadly Ebola virus has taken hundreds of lives in West Africa, and now it is literally on U.S. soil. 2 American healthcare workers contracted the illness in Liberia. Dr. Kent Brantley is now undergoing treatment here in the U.S. The second patient is joining Dr. Brantley, and there are reports of other possible cases. Rise News' Jahan Sharif reports.
A specially equipped plane carrying American missionary Nancy Wrightball arrived in Atlanta. A team of infectious disease specialists at Emory University Hospital will treat the 59-year-old along with fellow aid worker Dr. Kent Brantley. Wrightball and Brantley contracted the deadly disease while working in Liberia. 4 African nations are dealing with the worst Ebola outbreak in history. More than 1,600 people have been infected, and nearly 900 have died. Both Wrightball and Brantley have received an experimental serum to help combat the symptoms of the disease. The Center for Disease Control and Prevention is now investigating another possible case of Ebola at Mount Sinai Hospital in New York City. A man who recently traveled to West Africa went to the emergency room on Monday with a fever and stomach problems. He's now in isolation, and hospital officials are urging the public to remain calm.
If this were a case of Ebola, which we do not know, that it is not transmitted by casual contact.
The CDC expects to have a definitive test result in that case in a day or so. Jahan Sharif, Arise News.
Here now to discuss the latest on the outbreak and treatment of Ebola is Dr. Amesh Adalja. He is a representative for the Infectious Diseases Society of America and an infectious disease physician at the University of Pittsburgh. He joins us from Washington, D.C. Doctor, of course, we cannot understate how people are frightened here in the United States, but talk to us a little bit about the precautions that have been taken to isolate these 2 patients.
Yeah, thanks for having me. So the 2 patients that have arrived in Atlanta are having extraordinary levels of protection in their hospitalization. This actually goes above and beyond what you actually need to take care of an Ebola patient. So these patients are in a specially designed biocontainment unit in Atlanta, which is built to handle the most infectious diseases, things like SARS, which are much, much more contagious than Ebola. An Ebola patient can be managed in any ordinary hospital so long as standard infection control procedures are in place. People wearing gowns, gloves, masks, eye protection when they take care of the patient.
Doctor, we know that here in New York there was a brief sort of concern as they checked out a patient at Mount Sinai. What are officials looking for at the nation's airports or points of entry to prevent this disease from actually coming here and causing the havoc that it's creating in West Africa?
Well, I don't think that even if Ebola was imported into the United States in a traveler, it could set up an infection the way that's going on in West Africa, just because of the characteristics of how the virus spreads. And so it would not really find the United States very hospitable. But what we do is look at travelers that are coming from the 3 countries in which Ebola is widespread and ask them questions regarding whether they have if they present to a hospital, we ask them, do you have a fever? Do you have symptoms that are compatible with Ebola? Have you been in contact with someone who may have been experiencing symptoms of Ebola? And then those patients are isolated and then they're tested. And that's what we saw in Mount Sinai. That was an example of the system working well.
Now, since we first heard about this disease, this killer disease decades ago, doctors have made advancements in trying to help the human body battle it. We've heard more about this the ZMapp drug that's being tested now on one of the patients. What is it that any drug would need to do to the human body to help it fight this disease? Well, you can think of drugs as either working on the immune system of the body or on the actual pathogen, the virus. What the drug that was administered to these 2 patients does is it actually provides antibodies, which are naturally a substance produced by the immune system to fight viruses and bacteria. But what this drug does is actually takes an animal and has that animal produce antibodies to Ebola, and then these are mass-produced in a production line facility and then administered to the patients. And what we've seen is some promising results. And what that's doing is actually working with the immune system to help clear the virus from the blood of the patients that are infected. There's other drugs that do different things. They attack different steps in the viral life cycle. And there are drugs that may modulate the immune system to actually augment its response as well. But that's kind of how the drugs for Ebola will have to work in order to be effective. Even though certainly people are certainly concerned that the disease is now here, even though under controlled circumstances, Can you explain to us how U.S. researchers will be able to learn so much more now than they've ever been able to do before?
Now that these patients are at a modern hospital that has all the lab testing capability that you need, they will be able to look at the blood of these patients and look and see what the virus is doing. Are the virus levels going up? Are they going down? Are these people making antibodies? Are they not making antibodies? Are there secondary infections that are going on? They'll really be able to measure a whole host of molecules in these patients' blood in order to actually get a very intricate view of what Ebola is doing in a human. That's something that really couldn't be done in a resource-poor setting.
Let's talk a little bit about the testing of this new drug. Obviously, it was under desperate circumstances, but there are other drugs that are still on just below the market, haven't been given approval yet. What kind of ethics do we talk about when we talk about testing these new drugs? I'm sure there'll be a pressure for these other drugs to be used and brought into the treatment phase of what's going on now in West Africa. What kind of problems could that present?
So drugs usually go through a rigorous testing phase called phase 1, which is where safety is tested. These drugs that are being used for Ebola or that are in development for Ebola haven't reached that stage or are just reaching that stage right now. And usually drugs aren't used in this type of environment. However, the Ebola outbreak provided a compelling argument for trying to use these drugs ahead of time. We do have data in animals, non-human primates like chimpanzees, that at least the drug that was administered is safe and effective. So the question becomes, you have to weigh the benefits and risks of using a drug that really has been untried in humans versus the risk of death from Ebola. And there has to be informed consent, and individuals have to know they're getting an experimental drug. And that may be hard to do in an outbreak setting, and that may be why the two candidates that did get the drugs were people that are being now monitored in the United States, because you have to really watch these drugs to make sure that there's not a safety signal, that there's some adverse effect that's coming out in humans that didn't come out in animal studies. And I think that's an important thing to remember, is that although the people are dying and they're desperate for drugs, you have to make sure that you're not doing any more harm than good.
Dr. Amesh Adalja, thank you so much for sharing this information with Arise.